Seems like it's a yes. Thanks, Kim. Awesome. So we are going to get started. I just sent an email out a few minutes ago letting people know that it's going to be kind of a short agenda today. So I think we're all looking forward to that. It's a good day to have a short meeting. I wanted to start by kind of just letting you know the agenda. It's all the regular stuff. We're not going to go over any patient ping things today. There weren't any updates there. But if you have questions about patient ping, certainly chat those in. We will be doing the export of everybody's data from PHL on the 31st of August, and I'm hoping to get those out to you by the 4th of September. And then we talked about this last week briefly on the SASH coordinator call, but just wanted to let everybody know that we will be moving to Zoom for these calls. Not quite sure when, because we're still testing it out, but in the near future, expect a new invitation to all of these standing calls. And we'll definitely let everybody know when to expect that, but that's in the works, and that's kind of a software systems thing, so we'll include it today. All right. So if anybody has questions that they want to start with, feel free to chat them in. Otherwise, we'll just get started. Okay. So, Jolynn, this is all you.
Okay, good morning. And Jen, you were going to share your screen on this, right?
Mm-hmm. Yep.
Okay.
I'll get that going.
Okay, great. And I can let you know the name that we'll take a look at. So the first thing that we have to look at in PHL are a couple new PDF buttons that are available in the client demographics area. So Jen, the record we're going to look for is Catherine test, Jackson test.
Is this it?
Oh, I think so. It's a little small. Let me.
It's small. Okay, I can make it bigger. Thanks for letting me know.
Okay.
Tell me when. Is that okay?
Yeah, that looks good. That looks good. Yeah. And does that look better for everyone else as well? Okay. If we move over to this participant's client contact info tab, this is where one of our new PDF buttons is, and it's right down at the bottom to the left of the new contact info button. And so like most of the PDF buttons in PHL, if you click on it, it will generate a new PDF. Depending on your browser, the save button, it will download, show you a download button or give you a save button either in the center or to the left of the screen. Jen, are you able to open that PDF up so everyone can see what it looks like?
Yeah, I'm working on it.
Okay.
There it is. It's pretty big with this expanded view I made. How does that look?
Good.
Good.
Yeah, looks good. And so you can see it's just one of your typical PHL reports, but it is giving you all of the information, the contact information that is there in a printable version if you needed it for the participant.
Great.
And then you'll
Any
see
questions on this?
Great.
Well, I like that it has the print date here. I didn't know that was there. That's nice.
Yeah. And then if we go back to our demographics record, the other PDF button that will be quite useful is on the Contacts tab, again down at the bottom. And this will actually let you print all of the contacts that a participant has. There it is, and all of their basic information. And this was actually our staff member request, and looks good, it's working well, and could be quite helpful in certain situations. Any questions on that? Great.
We did get one question from Diana about printing notes. Yeah, we can go over that, Diana. Any questions about this new feature though? All right, do you want to go over visit notes real quick, Jolyn, while we're in here?
Sure. We may have a question from Betsy. Can you remove? Can't see the rest of it. Can you see it, Jen?
I think maybe that was a partial thought. Can you remove number and people? All right, yeah, we went over that last month, but we can go over it again for sure. So Jolyn, do you want to go over how to remove something from here?
Yes. What are we looking at for number?
I think maybe like the phone number.
Oh, okay. Okay.
That's my assumption. Is that right, Betsy?
So this actually ties into our next, one of our next workaround conversations as well.
Oh yeah.
Yep. So if you want to edit a record that's in here, so if we look at Sam Brown, for example, let's go in and look at Sam's record.
The phone number or the email address?
Well, let's pick the phone number.
Okay.
And we'll look at his entire record first before we go in and look at his other contact information.
Okay.
So one issue that can come up, and then we'll sort of answer your question as we move along here. So one question that can come up that we have to implement a workaround for in PHL is the fact that if we want to inactivate a contact for a participant, so a participant no longer wants this contact to be a contact, PHL doesn't give us the option to delete these records. So we would have to inactivate the record. So if Jen scrolls down, she sees the active button, inactivates it and saves. When she closes this and goes back to the contact list, that record is actually still there. And so it's difficult to tell in this table list view if that participant record is active or inactive. And actually, if Jen scrolls over, or actually you can see most of the table there, right? Mine's just blocked off a bit. Yep. You can see that none of the columns are actually showing us an active or inactive column. And we also don't see in this table whether someone has HIPAA consent as well. And that can be challenging because when you look at a participant's contacts, you need to know, right away if there would be someone there that you don't want to have contacted. And so we have to use a workaround for this situation. And I promise, Betsy, yes, this will also get us into our editing a phone number as well. So let's go back into Sam's record. And just as a side note, with PHL, we are actually working on adding the HIPAA compliance button and adding the active inactive status. We don't know when that will be available, but we are working on getting this added to the table. So what we need to do now is edit Sam Brown's record to indicate that this participant should no longer be contacted. And the way we do that is by making an edit in the first name or the last name field. So that's perfect, Jen. If you go into Sam and just write in all caps there, do not contact. And then we scroll down and we'll want to make sure we've still inactivated that active button, and then we save the contact's details. And if we close and go back, now you can see that you have a quick and easy visual indicator that this participant isn't someone that you want to contact. So that's a workaround that is fine to use, and it's good. It's a good workaround for this type of situation. We don't actually have inactive records disappear from this table, because sometimes we'll have a lot of cases where participants may flip back and forth. At one point they want the person to be their contact, or they don't. And so sometimes we'll have, we don't want those records to fully disappear from the table. But if you have to absolutely make sure that no one contacts that, if you want to make sure that that you don't actually ever contact a participant that contacting. I'm sorry, Jen, do you want to help me out here?
Sure. If you want all of this to kind of go away, you can write over it with some nonsense. So for example, if we just don't want to know about Sam Brown anymore, we could just put X's here. And then we don't know what this used to say at all.
Okay.
Is that what you were getting at, Jolynn?
I was trying to say that if you absolutely wanted to make sure you didn't contact somebody accidentally, then this was a good technique to use. But I like the X's as well. That also works, yes. I think that's what I was trying to say.
Similarly with the phone number and the email address and the physical address, you can do that in these areas as well. You can't delete them because PHL doesn't let us delete anything, but you can make this phone number all zeros, for example, and then save it. And then obviously you're not going to use that information going forward because it's nonsense. Beth asks, can you use the same process to indicate if they have HIPAA consent? So you wanted them to show up as HIPAA consent in this table? You certainly could do that. Yeah, absolutely. Just a reminder that anybody that does have HIPAA consent will show up in this table at the bottom of the person's client demographics page. So you should know that pretty easily when you go to their page. Just when you're looking at their name and their gender and their date of birth, if you scroll all the way down, anybody with HIPAA consent will show up here. But you certainly could make an edit to their contact name as well. That would work.
So good questions. Did we fully answer everything there before we move on to visits?
Kathy wanted us to go over how to make the PDF document one more time, so we could do that quickly.
Okay.
So
go ahead.
We're just gonna click the PDF version button at the bottom of this Contacts tab. And you'll see here that the only folks that show up in this printable version is the folks that are currently active. So I changed that one record to all X's and inactivated it, and so it's not showing up here, which is handy.
Yeah, that's great.
All right.
Okay, so
those are all the questions.
Yeah. So your visit notes are really printed the same way. You scroll down to the bottom of the visit notes screen, and there's your PDF version button. And when you click that, that's going to generate the PDF, and it will be downloaded to your computer. And then when you open it up, you should have your list of visit notes in chronological order.
And this document just generates all of the visit notes. So if you've been working with somebody for 7 years, that's going to be a pretty big document. So this may or may not work for your purposes, but this is how to do it if you want every single one. And there's no way to limit that. How many visit notes to see in this print to PDF document, unfortunately. Any other questions? Jolyn, I did want to say one thing more about the context.
Sure. Mm-hmm.
One thing that I used this kind of like funky workaround for when I was a coordinator is that there's not a really great place in PHL to put like a AAA case managers or home health and hospice case managers. So a nice way to do that would be to come in here and just do the same workaround. And then you can put something like case manager in here and save. And that shows up pretty nicely in this table so you can see who those folks are pretty quickly.
Perfect. Okay, we do have a question here, Jen. Is there a way, this is from Diana Rule, Senzel, is there a way to check everyone to see if you have the most recent Medicare number, like a list of your people instead of going into each individual file?
Yeah, absolutely, Diana. All you have to do if you want something like that is just either fill out the data request form on STAR or shoot me an email. That's like exactly the kind of thing I can do for you pretty quickly. We're going to actually go over a little bit of that kind of stuff later in the call, and I'll show you something that I'm going to be sending out to everybody at the end of August. Kathleen Pollen asked about the case manager thing, about why can't they be added to the Clinician tab. Good question, Kathleen. I think the main hiccup with that, with doing it that way is that, here, I'll show you. The Clinician tab, when you add a new clinician, you have to pick a practice. And right now, the way it's set up is it's just a super long list of all of the primary care practices for the areas that we serve in Minnesota, Rhode Island, and all of Vermont. And so I think if we started adding the services that provide case management and things like that to this list, that would be pretty unmanageable drop-down list. And I think people would be pretty unhappy about that. It's already too long for a lot of folks. So that's kind of why we don't add it here, because this practice field is a required field. Does that make sense?
And a question from Diana. Would be great if current primary care physician was listed on the SASH coordinator assessment. Is there a place that it is listed in PHL?
We definitely ask for folks' primary care physician information during the assessment, and it should live in the Clinician tab of PHL. Your team should be putting it in here. We've definitely been getting a lot of requests for that information from our community partners about like coordinating telehealth. So this can be something that's really useful for you and your team to make sure you're putting that info in here, and also for collaborating with our community partners as well.
And just a reminder, if you do have a provider in your area that is not listed in the clinician drop-down list, you can always let us know and we can add that as well. Let's see.
Andrea asks, is it also okay to put clinicians under the contacts and HIPAA consent and add those names to the UND? If that works for you and your team, sure. No reason that wouldn't work. Yeah, that's great. All right. Anything else you wanted to cover, Jolyn? Or any other questions from
I
folks?
think that covers anything. Kathleen has a workaround as well. She asked about a generic COA or the like, and then saying other is a choice on the bottom of that drop-in list. And I have listed the practice after the clinician name as a workaround.
Sure, yeah, that works too.
Yeah, sure. Mm-hmm.
That's great. We're so creative. Everybody's creative. PHL isn't like an exact match for SASH, and we just make it work. It's awesome. All right, I'm gonna go back to the PowerPoint.
Okay, great. I'm gonna mute myself. Thank you, everybody, but I'll keep an eye on the questions.
Cool. All right. All right, next, last week during the SASH coordinator call, Molly and I went over a lot of data about our SASH participants who we're serving, a lot of the funders that we are reporting out to and what they want to know about our participants. And it was a lot of information. And one of the things that I wanted to connect with you all about today is that there's like so many pieces of SASH that like the coordinators really take on and some that the wellness nurses really take on. And sometimes we don't fully know what the big picture of what everybody's working on as far as like specific grants and things like that. I know a lot of the wellness nurses have very specific things that they're working on with certain people that coordinators might not know every single thing about. So I made this tool to try and kind of connect some of those dots that might be helpful. So I just took the Community Healthy Living Action Plan document that you all use twice a year, and I kind of put all of the focus areas that we all work on together in here with the lens of both the coordinator's work, the wellness nurse's work, and also our grantors and what they want to know about the work that we're doing. So it's a little bit, I tried to make it easy to read, but I'm totally open to your feedback and questions. And I'm going to send this out after the call and you all can let me know if you have any questions about it. All right, I'm getting a request to make it larger. How's this? Better? Okay, great. So there's a lot of information in here about kind of some of the folks with certain kinds of conditions that we are working to support. Like for example, the first one is participants with diabetes or people that are at risk for developing diabetes. So if we look at it, we see that 26% of SASH participants have diabetes and 31 participants are at risk of developing diabetes, which is a gigantic chunk of our folks. And then here, there's a whole bunch of workshops and protocols and the screenings that we use to track that information about each and every participant. And you know, how often we look at it, the funders that are looking at this information, who's reporting out on it, and who has the lead on supporting the participants, and the duties of each kind of like part of the puzzle. I also included in here the updated directory of evidence-based and promising practices. Amy Rogers worked really hard on this to update it. It hadn't been updated in a number of years, so that's linked at the top here. And all of these links go to STAR. So when you get this, when you click on these links, it'll bring you to different parts of STAR. And STAR is great, but it's like kind of hard to dig into certain pieces of it. So I was hoping that this would make it easier for you to find information that you might wonder about when you're looking at this info. So just a couple more highlights. So a lot of our funders want to know about hypertension as well. 59% of our participants have diagnosed hypertension and 22% have undiagnosed hypertension. And if you were at the call last week, you'll remember that undiagnosed hypertension is anybody with their most recent blood pressure reading 130/80. So if it's greater than that, that's what we're calling undiagnosed hypertension. So any questions about this? All right, crickets. Again, this is something that I threw together. I'm sure it's not perfect. I know it's not perfect. So I'm going to send it out to y'all, and if you have thoughts or feedback, please let me know. All right, I'm going to go back to my PowerPoint. Beth says it's great. Molly says it's great. Okay, thanks for the positivity, you two. I appreciate you. All right, moving on. So we talked about this last month, but I wanted to just remind folks that this month you're going to be getting 2 reports at the end of August / beginning of September. One's going to be your regular monthly status report, and the other one is going to be called the annual data review report. So this is going to have information about anything about PCPs that's in PHL, information about insurance. We used to include that insurance information every other month in your monthly status report, but it didn't change all that often. And so we moved away from that, and you're going to just get it yearly now, so you can review it and update that yearly. There's going to be a sheet with contact information for each participant, so you can review that and update it if it's out of date. And then last but not least, your annual falls risk report is also going to be included there as you're getting ready for whatever September falls prevention activities you and your panel are hosting. So I'm going to give you a quick preview of what that's going to look like. It's not all that exciting. It's just like every other Excel spreadsheet you get from me. I'm going to make it bigger, so much bigger. So as you see here, this is the contact sheet. So you'll get your people's names, their address, their phone number, and their email address. The next one will be their PCP information. So as we were just looking at that clinician tab, anything that you had put in for a primary care provider name along with their site will show up in this report. We go to the next tab. This will be the insurance information. This should look familiar to folks that were here when we were using this as a part of the monthly status report. It'll just tell you if somebody has a Medicare number in there, a Medicaid number in there, or a different insurance number. But if you want that actual number, like Diana was asking about earlier, you can just reach out to me and I can send that information to you directly. And last but not least, that falls history report. You're going to get information about their last answer to their ambulation score. If they reported falling in the last year, the date of their last falls risk assessment, along with a score and the category for that assessment. So hopefully all that information will be helpful when you're getting ready for your falls risk or your falls prevention activities in September. Diana says, every Excel spreadsheet that we get from you is exciting. I don't believe that, but I'm glad that you, that you think it's helpful, Diana. Thanks for that. Jody says, really exciting work on the All SASH Community Healthy Living Plan. It will allow reconnection in all efforts for SASH and wellness nurses across panels and generate possible meetings and new opportunities for creativity. Awesome. Thank you for the feedback, Jody. I appreciate it. And Robin says, thank you. Okay. Any questions about this annual report? The intention behind it is just you spend so much time working with participants, and sometimes this like little nitpicky stuff, we forget about it. And this gives you a really easy way to see every single person on your panel and if it's up to date or not. Of course, if you want this more than annually, just ask for it and I can get it to you very easily. All right. I'm going to go back to the PowerPoint. Okay. All right, we're getting to the end. And I haven't taken up everybody's time, which is great. So just a quick update on Care Navigator. Melissa is going to be getting those next Care Navigator reports on your panels to you in the next few weeks. She wasn't able to join us today. She's at a suicide prevention symposium. But if you have any questions for her about those Care Navigator reports, you can reach out to her directly. And we are done. So just one last reminder, we are going to be moving to Zoom. Look for those, that information about what that's going to look like. I'm not quite sure when it's going to happen, but just want everybody to be in the loop. Any final questions? Okay, thanks everybody for being here. Happy Tuesday. Enjoy it.